Health leaders say they have detected variants of the COVID-19 virus all throughout our state. And as we continue to learn more about these new variants of COVID-19, we're just wondering, many of us, what they are and what we can do about them. So with that in mind, Fox 12's Simon Gutierrez went to look for some answers about how to slow or stop the spread of these new highly transmissible variants.
We spoke at length with Dr. Richard Corsi at Portland State University. He's not a virus expert, but he is an expert in indoor air quality and aerosols, which play a big role in spreading COVID-19.
We've been hearing a lot about these new variants of COVID-19 and the fact that they appear to be more transmissible. What sorts of red flags does that raise with you?
So being more transmissible is important. It doesn't change the number of aerosol particles that come out of the body of an infector. What it does is that the viruses that are embedded in those particles are more infectious. And essentially what that means is that once we inhale them, once we have a dose in our inhalation system, they're more effectively taken up by host cells in the body. What all of that means to me is that we have to be extra diligent. We need to quadruple down on doing everything we can to reduce our inhalation dose to these particles that contain the viruses. That means be extra diligent about masks, wearing masks, physical distancing, good ventilation in buildings that we're in.
A lot of workplaces will allow people to be working indoors, like an office space, if there's space between them and other coworkers, not wearing masks. Do you think that's something that needs to be reassessed?
Yeah, absolutely. I don't allow it in my building, so I oversee 2 buildings at Portland State University, and everybody's required to wear masks at all times. I've said this from the start, 6 feet isn't necessarily sufficient when you're inside of a building. It's generally sufficient if you're outdoors, especially if you're wearing a mask, but inside of a building, it's not.
What do we know now about aerosol transmission of this virus and, how long these infectious particles can hang in the air?
Certainly when you get down to 5-micron particles, they say suspended in air for almost as long as the air is in a building. I think what we've really learned from this more than anything else is how effective everybody wearing a mask can be. That if the infector is wearing a mask, even relatively crude homemade masks, that the level of emissions from an infector may be reduced by 50, 60%, even with not that good of a mask. And then if you couple that with somebody else who's a receptor wearing a mask, even if it's not that good of a mask, let's say it's a 50% effective mask, you take 50% reduction from the infector and 50% reduction at the receiving end, that's a 75% reduction in inhalation dose. It's a no-brainer that everybody should be doing that. And it has to be universal.
Dr. Corsi also said businesses and schools should do whatever they can to improve ventilation inside buildings using portable air cleaners and better air filters. He says that can prevent infectious particles from hanging in the air. I'm Simon Gutierrez, Fox 12 Oregon.